We are taking some time to raise awareness about breast cancer. It's something that impacts tens of thousands of women every year, and now that includes a well-known actress who is going public with her cancer battle. Olivia Munn shared on Instagram this week that she had been diagnosed with an aggressive form of breast cancer. The 43-year-old revealed that she's undergone surgeries and a double mastectomy over the past 10 months after a mammogram last year led to a discovery. She wrote that her diagnosis came after her OB/GYN decided to calculate her breast cancer risk assessment score. So joining me live in studio right now is Dr. Jessica Young. She's the breast cancer surgical oncologist and the director of breast cancer risk assessment and prevention at Roswell Park. Dr. Young, thanks for being here.
Thanks for having me.
Olivia Munn said in her post that every woman should talk to their doctor about this assessment score because that is actually what detected that there might be a chance that she would have breast cancer, and it came back that it was.
Yeah, absolutely. So I read her post, and she said she had a mammogram that was normal a couple months earlier, and then her GYN suggested she do the score, and when she came up higher risk, she had an MRI, and that's how she found she had breast cancer.
So what is this score, and is it something that we as women can calculate on our own, or do we have to do it alongside our doctor?
No, actually it's publicly available. It's called the Breast Cancer Risk Assessment Tool. So it's put out by the National Cancer Institute. It's actually a super well-validated score that really asks 6 very basic questions, and that can help you to calculate your score. So it asks what your current age is, what your race is, when you first started having your periods, when you first had your first child, if you have any, whether you've had any breast biopsies before and if they've been normal or abnormal, and then of course if you've had any family history of first-degree relatives. So pretty easy to answer those questions.
So you can actually go online and calculate it yourself?
Yep, and it'll give you a risk of your 5-year risk for breast cancer and then your lifetime risk, which is sort of more important for us. And then it'll tell you if you're higher than average or not. And if you are at a certain risk level, there are things that we can do to either help you find breast cancer sooner, like an MRI, or there may be risk reducing measures that we can take.
So if people go online and take this risk or take this risk assessment score, and at what percentage should they be concerned and talk to their doctor?
So the average risk for a female in this country is about 12 to 13%. So we generally define being at a higher risk probably about 20% or higher. And then when we're thinking about people who have gene mutations or things, those are people who are like 50, 60% higher. So 20% or so is enough to warrant getting extra screening.
And most importantly, where can people go online and do this?
Well, you can just look it up online, the Breast Cancer Risk Assessment Tool, and it's on the NCI website. Although it's also called the Gale model, you can probably find that in a few different places. And if you ever have any questions or concerns, especially if you're in the Buffalo area, you can always come to Roswell. We have a program that helps women to find out what the risk is. And actually, if you're normal, that can be super reassuring. And if you're at higher risk, we can help you figure things out from there.
Dr. Jessica Young here from Roswell. Where can people try to connect with you and get more information and resources from you?
If you just go to Roswell Park's webpage, you can just look for us there. It's really easy to get connected. Someone usually reaches back to you within a few days. So.
Thank you so much for coming in and sharing this information. Anytime a celebrity kind of shares their story, it really does spark all these interesting conversations and important ones, right?
Oh, absolutely. And I think one of the most important parts about this is that women don't have to have necessarily super strong family history. There are things that are just personal to yourself, your own risk factors that can be totally different from your sister, that put you at different risk levels. And that's, I think, what she really found. So
thank you. Very eye-opening for sure. Thank you so much, Dr. Young. We appreciate it.